How does someone become a narcissist? How does this disorder develop? This is a question that I'm asked quite often in therapy, so I thought I'd fill you in. Currently, different theorists have different opinions and viewpoints about the development of narcissistic personality disorder, and it's largely recognized that right now there's still so much more to learn. However, most researchers agree that the development of narcissism is likely due to a combination of 3 factors, and the first of those is genetics. You can actually inherit a tendency to develop narcissistic personality disorder. It often runs in families. There's a genetic component to the development of many psychological conditions and many personality disorders, and narcissism is one of them. The second factor is environment. Growing up with a parent that was either excessive with adoration or excessive with criticism can contribute to the development of narcissism. Exposure to traumatic events or experiencing abuse, neglect, or abandonment as a child appears to be common among people who are narcissists. And we call these events adverse childhood experiences. The last factor is neurobiology, which is a connection between your brain, your behavior, and your thinking. Recent research has indicated that individuals who suffer from narcissism tend to have abnormalities in the brain. In particular, research has discovered that narcissists have less gray matter volume in the anterior insula, which is a region associated with emotional empathy. They also have heightened activity during rest in brain regions associated with self-directed and self-absorbed thinking. A recent study found evidence for an association of narcissistic traits with variations in prefrontal brain structure. So looking at the brain through SPECT imaging or getting a SPECT scan can help identify abnormalities in the brain associated with narcissistic personality disorder and show issues of this disorder that may be biological. So, what can you do to prevent the development of narcissism, a disorder that can be so damaging to an individual's functioning in relationships? Because the cause of narcissism is not completely clear, there's no absolute known way to prevent the condition, but here are 3 things that may help. First of all, getting treatment as soon as possible for childhood mental health problems. If your child demonstrates behavioral problems, aggression, or problems relating to other people, consider taking them to a good child psychologist. If they're able to learn emotional regulation and appropriate demonstration of empathy, this may help to prevent the development of narcissistic personality disorder. Secondly, participate in family therapy to learn healthy ways to communicate or to cope with conflicts or emotional distress. Problems with emotional regulation are a hallmark of narcissism, so learning adequate skills in regulating emotions can be super helpful. Third, attend parenting classes and seek guidance from a therapist if needed. Because environmental factors have been noted to be a possible cause, parenting styles can contribute to the development of this disorder. Knowledge about the healthiest ways to communicate with your child can be enormously helpful. For more information on narcissistic personality disorder and for information on how to heal from the trauma of narcissistic abuse, please check out my Narcissistic Abuse Survival Toolkit. The link is in my bio. You deserve to live in peace and joy.